Welcome back to Ceasefire Oregon Educates, a video series by Ceasefire Oregon. Today we're going to talk about guns in relation to suicide. Often there's this floating question of, well, is there really a correlation between firearm ownership and firearm suicide? And the answer, in short, is yes. But it's important that we understand why that is, particularly so that we can take simple precautions to reduce firearm suicide. This video will be separated into two parts. 1. Facts and misconceptions about suicide by firearm, and 2. Legislation that can effectively reduce firearm suicide rates. First, let's break down some facts about suicide by firearm. In 2017, there were roughly 47,000 suicides, half of which were by firearm. What's not as well known is the variance of suicide across the United States. More specifically, suicide rates vary 4 times across the states. So basically, while one state might have a suicide rate of 5 people per 100,000, another's rate might be 20 people per 100,000. No other leading cause of death is that varied, which is important because it suggests a possible difference in outcomes based on state firearm law differences. Here's another thing we know about firearm suicides. They make up only 5% of suicide attempts, but 50% of suicide deaths. That's because firearm suicide attempts result in death 9 out of every 10 times. On the other hand, other forms like poisoning and piercing constitute 85% of attempts, but only 3% of ultimate deaths. Every month, 1,000 people die by firearm suicide. More, the annual firearm suicide rate has increased every year since 2008. The CDC Whiskers database determines this trend using a statistic called the annualized crude rate, which basically means the number of annual firearm suicides per population of 100,000. Along 2-year intervals from 2008 to 2014, this rate has increased from 6.13 to 6.27 to 6.43 to 6.56 to 6.65. Decimal increases may not seem drastic, but when we're considering that 1,000 people die by firearm suicide every month, it becomes clear that small increases can translate to many additional lives taken. An important note on these trends, and what we're going to focus on in this video, is how these firearm suicide rates are affected by firearm ownership. In a study conducted by the Harvard School of Public Health, jointly with the National Center for Health Statistics, researchers found a robust association between household firearm ownership and firearm suicide rates. This accounts for the U.S. as a whole, males and females, and various age groups. In the study, researchers compared 4 low-gun states, Hawaii, Massachusetts, Rhode Island, and New Jersey, to 6 high-gun states, Louisiana, Alabama, Mississippi, Wyoming, West Virginia, and Arkansas. I should add that the reason why they compared 4 states to 6 was to ensure equal population sizes in their comparisons. They found that states with higher gun ownership were associated with a 14% higher firearm suicide rate than those with low gun ownership. An important point raised by the study was that individuals who are determined to take their own lives will work to get a gun where guns are less available, or will substitute other equally lethal means. But even with a 100% substitution rate, meaning if every firearm suicide attempt were replaced with alternative means, the overall completed suicide rate would still decrease because non-firearm means have substantially lower mortality rates. We're now able to understand firearm suicide from a broad lens, but let's understand what firearm suicide risk looks like within the home. 2 main factors influence firearm suicide risk. 1. Immediate access to firearms, and 2. Unrestricted access. Considering that easy, unrestricted access is the determining factor of firearm suicide risk, securing guns in the home is the most effective way in which we can reduce that risk. The first and most direct method to reduce firearm suicide risk is to implement safe storage laws. Currently, 27 states have safe storage standards. Oregon is not one of them. A law requiring trigger locks or storage in a locked container could be incredibly effective in enforcing responsible gun ownership and reducing risk of firearm suicide, considering that nearly 380,000 guns are stolen from individual gun owners annually. And, according to Giffords Law Center, modest increases in the number of American homes safely storing firearms could prevent almost a third of youth gun deaths due to suicide and unintentional firearm injury. A second method we can use to reduce firearm suicide risk is the Extreme Risk Protection Order, which we discussed in our previous video. These orders allow family members, household members, and law enforcement to report someone they know as being at risk of harming themselves with a firearm. A third method we can use to reduce firearm suicide risk, and this would be through state legislation, is to implement healthcare-based suicide prevention programs. These programs would allow medical professionals the training, freedom, and support to effectively counsel patients about gun suicide and gun safety through an objective lens. Washington State is a primary example of this. In 2012, it passed the Matt Adler Assessment, Treatment, and Management Act, which requires medical professionals to receive suicide prevention education and training every 6 years. But many legislative efforts have sought to prevent medical personnel from counseling their patients about firearm use. In 2011, Florida passed the Firearm Owners Privacy Act, which prevented medical professionals from making written inquiry or asking questions concerning the ownership of a firearm or ammunition by the patient or by a family member of the patient. Ultimately, the law was struck down in 2017 because it interfered with the physician's First Amendment right. Similar laws have been introduced in 12 states, the majority of which have been blocked or defeated. The vast majority of people disagree that firearm ownership influences firearm suicide risk. In fact, only 15.4% of overall U.S. adults agree that a correlation exists between the two. 6.3% of firearm owners agree. 19.8% of those who live in a home without firearms agree. 30% of healthcare professionals agree. Suicide rates have increased over the past 17 years. And, as we've learned, firearm suicide rates make up half of those. Firearm ownership rates may not change, but through these methods, safe storage, extreme risk law, and healthcare-based suicide prevention programs, we can effectively reduce gun violence and keep families and their loved ones safe. Thank you for watching our second episode. If you'd like to stay updated, please subscribe. We'll be back soon.